I still know that as long as life will exist, Africa will exist. And as long as Africa will exist, medicine will exist in Africa. And if medicine exists in Africa, then doctors will need to exist in Africa who will practice medicine. And not everybody wants to practice medicine in US, Canada, Australia.
Definitely.
Yes. I do think, do you really think that medicine is lucrative? I mean, really lucrative money making in Africa. How is public health in Nigeria?
Okay. So this was how I narrowed it down to public health per se. Despite having the fact that preventive medicine. So my initial plan was that, okay, maybe I would do a master's in public health. Okay. Mm-hmm. So one day I remember having a conversation with a friend who schooled in Nigeria, and the person was telling me,
if I can interrupt, I'm sorry. Can you please put a little difference? What's the difference between a master's in public health and a residency in public health?
Okay. So a master's in public health, it's a narrow specialty. You might have epidemiology, you might have a couple of specialties there, but I don't think it goes beyond 3, 4, or 5 specialties. Besides, it takes like a year. The most you can get a master's in public health will just be 2 years. Okay. But a residency in public health now, to get your full fellowship, it's going to take you at least 6 years.
Wow.
And within that time frame, you have a total of about 12 subspecialties.
I see.
Yeah. So an example now, we all know of epidemiology, right?
Yes.
That's one of the subspecialty. Biostatistics. If you say, I don't want to even see people at all, I want to be a data guy. Biostatistics. Yeah. And then there's occupational health that steadily busts my brain. And what do I mean by busts my brain? So there was a time I went for my occupational health junior posting, okay? And it was for like 2 months. And guess where your girl was working? I was working in a factory, like with the safety boots, with the t-shirt. I wasn't a doctor for 2 months, please. Like you get to work in an occupational health setting. And then you identify hazard. You're just keeping people safe, and obviously, when you're keeping them safe, these big companies, you're keeping them safe. You get the money now.
You get the money.
So that's a subspecialty. Then there's environmental health. Think of every component of the environment, from light to water to waste. That's another subspecialty. And there's international health. If you decide to go into travel medicine. If you want to work in the airport, port services, that one is there. If you want to go into family and reproductive health, you want to work with UN, UNICEF, this maternal and child care, it's all there. If you want to work with the school health, it's there. So there are whole, and then the people like you that don't even want to see the 4 walls of the hospital at all and say,
no, we don't want to.
Health. I want to be into health policy. There's a subspecialty, health policy. There's health leadership and management. So there's a ton of subspecialties under the residency training. And the beautiful part is that while you're in there, within these 6 years, you actually go around all of them and you're vast in all of them as well. And at the end of the day, after you pass your membership, which is after like 3 years, you can then go and choose one subspecialty. But still, as a public health trained physician, you can work in any of those specialties. So it's way different. Plus the side of the clinical exposure you get as well.
Yes. I'm so amazed. Like, it's just like I was in awe. Like, you were taking me to that part.
That was how I was when I found out about it. And I'm like, what? I'm like, it's almost like, okay, wait, let me get you the curriculum. I actually took the curriculum. I took out time. I read it for like 2 days. I'm like, no. I said, you know what? Get me materials. This is what I'm going into. And that was it. Yeah. That was it.
Yeah. He died at the age of 86, if I'm not mistaken. And as at 2020, when I was doing my board exam, he took me for surgery. The man took me for surgery. The man would be coming, bent, leaning forward like that, taking a step to the examination hall, and he was still conducting the exam. So, I mean, this just simply answers the question: are people actually enjoying doing the medical work? Yes, that man did the medical work till death. Yes, he did the medical work for over years. And I can tell you that if there's no anything satisfying, probably he would have stopped by the time he went on pension. But he was still helping raising more young doctors to almost become just like him. Yes, so I can say that there are a lot of people, and not just only him, a lot of gurus over there who are still practicing medicine even after their pension days. And it tells it all that it's very satisfying. Yeah.
Okay, great, amazing. And this doctor, I'm sorry I didn't catch his name. He practiced in Ghana, right?
Yes.
Oh, okay, that's really wonderful. So you guys have heard it. There are people who
that
practice.
Is Dr. Achiampon. Dr. Achiampon. They usually
be called upon. What can we do? Different aspects. What can we do? Those in the biostatistics. What are the data we're getting? How can we make projections with this data? And people are getting paid for what they're doing. Do you understand? So all of these specialties are actually very lucrative. Occupational health is very, very lucrative. I think people are looking at that, especially the guys. They are looking at it because they love the whole feel of being outside the clinical setting. Is very lucrative. Maternal and child health is very lucrative. Come on, look at Nigeria, for example, now. Mothers and their children make over 70% of the population. And say you're a public health physician and UNICEF, let me just give you a very simple example. UNICEF is coming and they want to launch a program and you're the public health physician on ground and you are a grassroots public health physician. So you're working with them, you're liaising with them, you're enjoying your job and you're getting paid for it. Unlike the typical Nigeria that want you to do something out of goodwill. These people don't expect you to do it out of goodwill. You're bringing in your knowledge, so you will be paid for it. It's actually a very lucrative specialty outside the hospital. Do you understand? But if you still decide to be within the hospital, just like what we do now, I work in a federal medical center, so my training is different from the person in the teaching hospital because we tend to add a bit of clinical medicine into ours. Let me give you an example now. Right now, we're having the pandemic. We're also having various outbreaks. You know, in Nigeria, this is Lassa fever season. So it happens in the dry season, basically. You know, it's caused by the rats. The rats carry the virus. So the rats, when it's dry season, the rats come out to play and So basically what we do in my center is that whenever there's any case of suspected infectious disease, they call the public health physician, we set up things in place to protect both the patient and the healthcare worker. So you could decide as a public health physician that, okay, after I'm done with my training, I don't want to leave the hospital setting. Sure, I won't be the one doing surgery, cutting babies and all of that, but you're going to prevent infectious disease from escalating, not just within your hospital, but in the community as well. So it could still be a bit clinical, but without getting core clinical. So we call him
Bajaman. So anybody in Africa who, West Africa to be precise, who is more into the medical fraternity, surgery to be specific, should know that Baja book. Baja book is one of the main pioneers of that particular book.
All right, great, amazing. I'm so excited because I'm all about spreading good vibes. I'm also about speaking the truth. I love the truth, but
that's not how it is in Nigeria. You have a department, they are third-year residents, but no first or second-year residents. Do you understand? Even currently now, I'm a second-year resident, but there are no first-year residents. And it doesn't seem like there'll be anyone in the future anytime soon. So, but you just have it handy, and it might just, for me, I think when I was ready, I waited a while. That's the truth. After my NYSC, I had my primaries, but I waited a while. But I was lucky enough that I told God, I said, okay, this is what I want. But for the meantime, what am I going to do? I didn't just, at that point, I think I was just all out of clinical medicine. So I knew I am good enough to work as a clinical physician, but then I would not enjoy it. I don't want to wake up in the morning and be sad about going to work. So God gave me a place that was a primary care center, but then they were into lifestyle medicine.
Oh, lifestyle.
So that was just amazing. So just a little
light. What's lifestyle medicine?
Okay, lifestyle medicine is an aspect of medicine that deals with managing chronic conditions using lifestyle methods.
Great.
And these lifestyle methods include sleep, fitness, changing habits, just a whole lot of lifestyle methods. So basically, you're not taking medicine to cure a disease. You're bringing about lifestyle changes to cure those diseases. Because come to think about it, most of these chronic conditions we have now, they are as a result of lifestyle choices. Do you understand? Look at type 2 diabetes.
Yes,
adult onset diabetes. Yes, lifestyle choices.
Yeah.
Okay, most cases of, we know that hypertension, there's genetic, is essential. But we notice that for some people, just by losing weight, cutting out certain things from their diet, their blood pressure starts becoming normal. People having increase in their cholesterol.
I still know that as long as life will exist, Africa will exist. And as long as Africa will exist, medicine will exist in Africa. And if medicine exists in Africa, then doctors would need to exist in Africa who will practice medicine, and not everybody wants to practice medicine in US, Canada, Australia.
Definitely.
Yes, I believe many people have had the choices and they just decline the choices because they love medicine in Africa. Now, everyone is allowed to differ. If you do not agree with me or Dr. Ebenezer, you can actually comment down below in the comment section. Okay, now, apart from that, I love to practice medicine in Africa, West Africa, which we can talk because that's where we have more information. Now, this begs the question, do you really think that medicine is lucrative? I mean, really lucrative money making in Africa, West Africa, if you want to speak, or in general terms.
This question is a little bit dicey.
Mm-hmm.
And if I should take it in two ways, I can say that let me speak for my West African people.
Mm-hmm.
For what usually happens at the South, I think I don't have much info to touch on them. But
mm-hmm.
for West Africa, for what I have seen.
So helping us today with this topic will be all the way from the gold city of Accra. Is Accra called the Golden City?
Golden City is Cape Coast.
Cape Coast. What is Accra called?
Accra is the capital.
Okay.
The capital city.
What you're in military hospital, right? Kolebu?
Yeah, military hospital.
All right. So all the way from the capital of Ghana, precisely, all the way from military hospital in Accra, is Dr. Ebenezer. So once again, welcome back to this channel. Can you please introduce yourself?
Yes, thank you very much, and happy Christmas to all your viewers and all your listeners.
All right, it's a wrap. The cameras gave up, not the camera, the battery, right? The batteries gave up on us, so that'll be about it. I'll see if I can do one more Zoom recording, and that's about preparing the content for 2022. Hope that it will be helpful, both the educational content, mental health content, and all content I will be serving. Have a wonderful, wonderful time. Like, share, subscribe, and anticipate these videos. Bye.